See my screen?
Yeah, you're all.
Okay, great. All right. Me. Okay. Yeah, so thank you very much for having me today. My name is Rie, and I'm the Community Education Coordinator at the Center for Healthcare Rights. And today I'm going to share some general overview of Medicare so that you understand how Medicare works. And if you have any questions at the end of the presentation, please ask me any question you have, or if it's too personal, you can give us a call. And let's see. Our phone number is listed here, but before I do that, I wanted to share a little bit of background of our organization. So Center for Healthcare Right is a nonprofit organization, and we provide free Medicare education, assistance, and advocacy services to Los Angeles County residents. And we are not part of Medicare, but we work with Medicare. And we are not agents or brokers, so we don't sell anything. And we offer free, unbiased Medicare information and assistance because we get the funding from California Department of Aging, Health Insurance Counseling and Advocacy Program, also known as HICAP, HICAP. And if you have Medicare already, you receive Medicare and You booklet each year. And I have one here in front of me. So you receive something like this. And when you flip the booklet, it says in the back of the book, it says, call this number for free personalized health insurance counseling. And they list our phone number, 1-800-434-0222, because we work with Medicare. So if you have any questions or you want to talk to us, please give us a call. Our business hours are from Monday through Friday, 8 a.m. to 5 p.m. And when you call us, you need to make an appointment. So please don't expect that your questions will be answered right away. We also have some information listed on our website. That's www.healthcarerights.org. And we have some fact sheets that's pretty helpful. So please, when you get a chance, please browse our website and see the information. Okay. And we are also known as HiCap, and I'm one of the HiCap counselors, and we have uh, HiCap counseling throughout Los Angeles County, in addition to phone counseling. So here is a list of places. I'm sorry, I think I want to move this one a little bit. Okay. Yeah. So we have many different counseling sites throughout Los Angeles County, and those are mainly at the senior centers. And also, like in Torrance, we have a counseling site at the Torrance Memorial Hospital. So if you'd like to talk to somebody in person, please give us a call and make an appointment. Okay. And today I am going to talk about what Medicare is, who qualifies for Medicare, Medicare benefits, and finally, I want to talk about Medicare fraud. So the first thing is, what is Medicare and who is it for? So Medicare is a federal health insurance program for people who are 65 or older, and you need to be a U.S. citizen, or if you're not U.S. citizen, you need to be a legal permanent resident, and you need to satisfy residency requirements. That's like you need to live in the U.S. for 5 years consecutively. And if you are younger than 65, and if you have a permanent disability, you can get Medicare after being on Social Security's disability insurance, SSDI, for 24 consecutive months. So on the 25th month, your Medicare will start automatically. If you have ALS, also known as Lou Gehrig's disease or end stage renal disease, your wait time can be much shorter. And if you have any questions about your eligibility, you need to contact Social Security office. And important thing here is Medicare is not based on your income or asset, like how much you own. And Medicare benefits. So Medicare has different parts, and different parts of Medicare covers different benefits. Part A covers hospital services, home health care, skilled nursing care in a skilled nursing facility, and hospice care. Part B, as in boy, covers doctor services and other outpatient services like ambulance, lab x-rays, durable medical equipment like, wheelchairs, walkers, CPAP machines, diabetic supplies, and so forth. Uh, Also preventive care like uh, flu shot, COVID shot, cancer screenings, and some other stuff, outpatient therapy, and also mental health services. Part C and D, well, first of all, I'm sorry, Part A and B, they are offered by government, and they don't cover your prescription drugs. So you need to join, I should say, you want to join a prescription drug plan. And you have two options. One is Part C. It's also known as Medicare Advantage Plan. And it typically combines all Medicare Parts A, B, and D. So what's D? D is prescription drug benefits, D for drug, and it covers only prescription drugs. And I will go over this C and D, the differences between C and D in more depth in later slides. So here, I just want you to know that Medicare has different parts, and different parts covers different benefits. And Medicare's enrollment period. So Medicare is not something like you can join anytime you want. You have a specific time to enroll, and different parts of Medicare has different time to enroll. But the first one, initial enrollment period, this is the same for all Medicare parts. You have 7 months total initial enrollment period. It's also known as IEP, and it starts 3 months before the month you turn 65, and the month you turn 65, and 3 months after. So total 7 months. The next one, I would go to the special enrollment period. Special enrollment period is for those who go through life-changing events. And if you miss your initial enrollment period, or if you didn't join Medicare during this initial enrollment period, and if you have special enrollment period, you can join Medicare. If you don't have special enrollment period, and if you miss the initial enrollment period, you can join Medicare only during this general enrollment period. That's from January 1st to March 31st every year. So if you don't have special enrollment period, and if you don't join Medicare during the GEP, basically you need to wait for the next year's GEP. So it's really important to know when you can enroll in Medicare. Now, when you say, you turn 65 and you join Medicare by contacting Social Security, because that's where you enroll in Medicare Parts A and B. If you remember, A is like hospital and other like inpatient services. B is for outpatient services. When you call Social Security to join Medicare, you have A and B. And for majority of the people, having Part A is free. You basically need to work in the US for at least 10 years, and you pay into Medicare tax for at least 10 years. Then you can get Medicare Part A for free. But once you start using Part A, you have this out-of-pocket expenses. And Part B, as in boy, the outpatient services, it has comes with monthly premium, which is $202.90 this year. And if you are high income earner, you will have surcharge on top of this $203. If you miss the initial enrollment period, and if you don't have special enrollment period and join Medicare Part B, like say during the GEP, general enrollment period, you may have late enrollment penalty. You might have heard, from somewhere before that if you don't join Medicare at the right time, you may be penalized. This is what it is. So say if you miss your enrollment and, or say if you are healthy and at age 65 and you think, oh, maybe I should just save my money and not join Part B. And like say 2 years later, you thought I'm gonna join Medicare now, then you most likely have this late enrollment penalty, and it's 10% per every 12 months period. It's like say if you had a 2 years gap, like the time you could have had Part B, but you didn't have, your penalty will be like 20% of that year's standard Medicare Part B premiums. And it's not just one-time thing, it's lifetime. So we always tell our clients, you should join Part B no matter what, if you can. Otherwise, you should try to look for like a financial assistance program and so forth. But it's really important that you join Part B as in boy at the right time, because you may face this late enrollment penalty. Once you join Part B and you start using, you have annual deductible, which is $283 this year, and it changes each year. And when you have Medicare Parts A and B, it's called original Medicare. You have original Medicare. And when you have original Medicare, you have 20% co-insurance. Like if you go to see a doctor, say that charge was $100, Medicare will pay $80, and you have $20 co-insurance. It's percentage based. So it can be very expensive because it can be 20% of $100 or $10,000 or $20,000. So Medicare can be very expensive. And actually, before I started working for the center, I thought Medicare was free, but it was not. It's really, really expensive. Okay, so now Medicare doesn't cover 100%. You have out-of-pocket expenses, or there are some things that Medicare doesn't cover. Those are dental, vision, hearing aids, routine podiatry, incontinence supplies, transportation to and from medical services, and custodial service. It's basically long-term care. So you want to figure out how to fill this gap, or how to supplement your, like say, out-of-pocket cost or benefits that Medicare doesn't cover. And you have options to supplement your Medicare expenses. The first thing is you want to decide whether you want to keep your original Medicare or you join Medicare Advantage Plan, also known as Medicare Part C. So if you have original Medicare, you want to join Medicare Part D, as in drug. That covers your prescription drug only. And if you have original Medicare, as I mentioned earlier, you have 20% co-insurance. So you want to buy, or you want to have a secondary insurance to cover your out-of-pocket expenses. And your option is to First one is to buy Medigap, or it's also known as Medicare supplement insurance. And you buy Medigap if you have retiree coverage, if your former employer provides you any coverage, you can join retiree coverage, or you can apply for Medi-Cal, which is income and asset-based program. And if you have original Medicare, you can go to any doctor you want, you can go to any hospital you want, as long as they accept original Medicare. And more than 90% of doctors and hospitals accept original Medicare in the United States. So it really doesn't matter if you're in California and say if you heard this doctor in Oregon or let's say Rhode Island, this doctor is really renowned for something. You can go to see that doctor if you have original Medicare, as long as they accept original Medicare. And as I mentioned, it can be very expensive. The second option to supplement your Medicare expenses or benefit is to join Medicare Advantage plan. And under Medicare Advantage plan, there are HMO plans and TPO plans. But if you join Medicare Advantage plan, your out-of-pocket expenses upfront cost is much lower than having original Medicare. Could be lower than original Medicare, I should say. And Medicare Advantage plans they must give you the same benefits that original Medicare gives you. And they can add additional benefits like dental, vision, transportation, acupuncture, or transportation to and from doctor's office. And also, they can give you over-the-counter medication benefits and stuff like that. So the Medicare Advantage plans are becoming really, really popular these days. But you want to know that those are pros that you can get extra benefits, but you want to know this is really a negative part of this Medicare Advantage plan. I would think you have to go to the plan specific provider. So each plan has a network of providers. So if you select a plan and join the plan and you find out that your doctor doesn't accept the plan, you have to switch the doctor or you have to pay the services 100% out of pocket. So it's really important, especially because, when I talked to my client before, I contacted City of Hope, and I learned that this year they don't accept or they don't recommend having HMO plans because it's really this network thing is very, very complicated. And there could be, I think many patients had faced some out-of-pocket expenses because the plan didn't cover or they didn't give approval for the authorization and stuff like that. So if HMO plan or Medicare Advantage plan in general, it may save you expenses upfront, but there are some not monetary, but some cost that negatively impact you. So this network is one of the things. And also like many HMOs, they have this prior authorization process for many services. And even though your doctor say, you want to get these services, when the doctor submit this prior authorization to the plan or the medical group, they may deny that services. And then you want to, work with your doctor and appeal the denial and stuff like that. So it can be negatively impact people's, care access. But it is true that some people are very happy with Medicare Advantage plan because it's, you don't have to look for doctors on your own. Your primary doctors will refer you to specialists, and you don't need to really worry about where the medical records are because the plan or the medical group has your medical record. So you can request the plan for the record to your specialist and stuff like that. So some people are very happy with Advantage plan, but some people they may not be happy because of the restrictions they have. So that's what you want to remember. But this is uh, one of the way to supplement Medicare expenses and also the benefits that they don't cover. So if you decide to go with original Medicare, which gives you more flexibility in terms of which doctor you can go to, but it can be very expensive because um, you, first thing is if you decide to have a original Medicare, you want to join a Part D prescription drug plan. And I have a slide talks about the cost of this Part D prescription drug plan. But we have only like 12 prescription drug plans available in Southern California this year. And the price for the to have this plan, the premium range really varies. Like one plan is $0 monthly premium, but the most expensive plan has almost like $228 monthly premium. So that's, one thing like you want to consider like as an expense. Buy Medigap, the supplement insurance that can become your secondary insurance. And if you decide to buy Medigap, it can cost about $170 per month for somebody who is 65. If you're younger than 65 and try to buy Medigap, it can cost very expensive. The third option here is apply for Medi-Cal. If you qualify for Medi-Cal, Medi-Cal can become your secondary insurance, and it will pay for your Medicare Part B monthly premiums, and also it will pay your co-insurance or co-payment, whatever the expenses you have after Medicare paid by Medi-Cal will pay for those expenses. And if you're lucky to have a retiree plan option, you can join that too. But you want to compare the cost and what it's going to cover, because sometimes it can be very pricey and it may be better to go with Medicare, Medigap, or Medicare Advantage plan. And so Part D drug plan choice, and the Part D is, as I mentioned, it covers only your prescription drugs. So it works with original Medicare, Parts A and B. So if you have original Medicare, you can go to any doctor you want. You can go to any facility you want. Medicare covers 80%. You have 20% copayment. And also you pay Part D's monthly premiums. And also there are some copays when you get the medication actually. So these premiums and co-payment amounts are really different from plan to plan. So it's really important for you to check the benefits before you join Part D plan or any plan actually. Okay, so that's Part D. And Medicare supplement, if you want to buy supplement insurance, it's offered by private companies, and there are 10 plans available, and it's labeled with alphabet A through N. And so there are different plans available, and plan A is the very basic plan, and other plans add more benefits to plan A. And the most comprehensive plan is called Plan G, as in golf. And if anybody sells Plan A or say Plan G, it's basically the same it doesn't matter who sells the plan A or G, the benefits are the same because Medicare standardized all Medigap plans. So the price is the only difference between the same alphabet plan. So when you shop around, some people really worry about the brand name and stuff. But when it comes to Medigap, price is the only difference between the same alphabet plan. And some Medigap plan have a foreign travel benefits that covers emergency medical expenses, but it's it's better to check on or buy travel insurance if you wanna travel overseas. You don't wanna rely on Medigap on this one. And best time to buy Medigap insurance is when you have Medicare Parts A and B first time. Um, when you have A and B first time, you have 6 months to buy Medigap, and it's called you have guaranteed issue rights, GIR. What that means is when you buy Medigap during this time, you can buy any policy that you want, and they offer with without going through medical underwriting. So you can buy Medigap that you want at the best price possible. And if you miss this opportunity, and if you wanna, try to buy Medigap without having this guaranteed issue rights, you go through medical underwriting, and Medigap companies, they can deny you coverage. So you may end up not being able to buy Medigap. Then you get stuck with the 20%. And if you decide to go with Medicare Advantage plan, the option 2, uh, basically this plan takes over your Medicare, and they provide all your Medicare benefits, A, B, and D. And so each plan has network of their own doctors, the contracted doctors, and you need to see those doctors. And if you have HMO, you need to have a primary doctor. And if you need to see a specialist, you need to get a prior authorization referral from your primary doctor. And many services require prior authorization. So it can be more restrictive in a sense, which doctor you can go to, and also when you can get the services that you need. But it's much cheaper upfront because many Medicare Advantage plans offered in Los Angeles County, there is no monthly premium to join Medicare Advantage plan. You still have to pay Part B premiums, but many plans have no monthly premium to have it, which is, like totally different from Medigap, because Medigap, just having Medigap costs you like $160, $170 per month. Here, Medicare Advantage plan, you have no monthly premiums. And many plans offer these additional benefits. It can be dental, vision, hearing aids, transportation to and from medical appointments, over-the-counter medication benefits, gym membership, and so forth. So, and some plans, they start offering these like a cash card and stuff like that you can use on utility bills or fresh food and stuff like that. So, um, you know, depending on the plan, these benefits are different. So if you're interested in getting Medicare Advantage plan, and if those additional benefits are very important to you, you want to make sure before you join the plan, if those benefits are actually applied to you, you want to find out how you can get those benefits. Like, do you have to have a certain condition, like a health condition, to receive those benefits? Or is it like actually limited to certain geographic locations? You want to make sure to find out how you can access to these benefits. And also, uh, you know, I mentioned that these plans may offer dental benefits, but you want to make sure, if you have any dentist that you want to keep, do they accept that plan? You want to confirm that before you join any plan. And plan premiums and benefits vary. So yeah, some plans or many plans, there are no monthly premium for to have the benefits or to have the plan, but some plans they have monthly premiums. So you want to make sure that you know what's involved before you join. And difference between HMO and PPO. So HMO is you need to have a primary doctor, and primary doctor will refer you to a specialist. And so you cannot just go to see a specialist that you like. You need to go through these steps. And specialty services are authorized by your medical group. So if, like, say, your doctor orders a MRI, you you need to have a prior authorization from your medical group, and they may deny it. Then if that's the case, you need to appeal so that you can get those services. Or they may tell you to do something else first, and then like you need to do like the plan can give you these additional rules that you need to follow. So that's like one of the negative things about the HMO plans. And you must use network providers unless you need emergency or urgent medical care. So yeah, as I said, there are each plan has network of doctors. So you need to stick with the doctors who are in that network. If you go outside, then you need to pay 100% out of pocket, or you need to switch the doctors. So it's really important to know these rules that HMO has. And PPO is kind of like an in between HMO and original Medicare. What that means is, PPO, if you have PPO, you don't need to have a primary doctor, but the plan has a network of doctors that's called preferred provider network. So if you go outside that PPO network, then you pay higher copays. And also, these PPO plans are still managed care plans. So my understanding was that you don't need to have like a prior authorization to receive any services, but I heard from some clients that they needed to have prior authorization to get certain services. And also there are some doctors, they say, I don't accept Medicare Advantage plan, period. So then you need to look for different doctor who accepts your PPO, or like even it's outside PPO network, you want to make sure that they accept your PPO plan. And when you are considering joining Medicare Advantage plan, very important thing is, if you have any doctor that you want to keep, you really want to check with them if they accept the plan you are considering, because I already mentioned this earlier, but it's really important that you know that your doctor accepts your plan. Otherwise, you have to switch your doctor, because you cannot change your Medicare Advantage plan or any Medicare plans that easily. You have certain times to switch, or switch your plans. So it is very important to answer this question if you have any doctor that you want to stick to. And also you want to know how much you are going to pay for office visits, hospital care, or specialty services. Some plans, there is no copay to see primary doctor or even a specialist. And they have like some copays to pay for hospitalization or emergency care or lab and stuff like that. So different plan has different price settings. So you really want to know when you compare these plans, how much you may pay when you receive those services. Are my prescription drugs covered? So this is also important. When our clients call us, we go to Medicare's website, medicare.gov website, because they have a plan finder tool, and you can just, if you don't have Medicare account, you can just put your zip code in, and you can uh specify which plan or which Medicare options you're looking for, C or D, Part C or Part D, and it will ask you if you want to compare your drug price. And then if you say yes, you can put all your medication information, and you can uh, put in which pharmacy you want to go to. And this plan finder tool will bring up the plans that cover all or most of your medication. And then you can see which plan is the cheapest, and so that you can kind of go from there. And say if you're interested in Medicare Advantage plan, you want to make sure all these important things are checked. And then, I mean, I think if you're taking any medication, I think it's really important to know how much you are going to pay. But if you have like a lot of money in your bank account and you don't mind spending a lot of money, maybe it doesn't matter. But you know, you want to know what's your priorities are. Like, is that your doctor prescription or the additional benefits? Like, do you want to have dental and vision, or do you want to have gym membership? What's the most important thing for you? And then you want to check all these, things before you join that plan to make sure that you have good coverage that you need. Okay. And so Part D plan cost and benefits, as I said earlier, it really depends on the plan you join. And the annual deductibles that plans can put on this year is up to $615. And plan premiums can vary from 0 to $227.80. And if you're talking about drug plan, the Part D prescription drug plan, the higher monthly premium plans tend to have lower deductible cost, because you're basically paying the deductibles each month. They just include these deductibles into the monthly premiums. So when you have no deductibles, and if you have very expensive medication, from day one, the plan will cover. So your uh, expense will be not too, like a first month expense is not going to be that high. So some people, these very expensive premium plans work out very well, but you want to really research before joining a plan. It really doesn't matter, doesn't mean that most expensive plan is the best plan. And since last year, Medicare Part D has a maximum out-of-pocket expenses. So once your out-of-pocket expenses reach this year $2,100, you pay zero for the rest of the year for your medication, the covered medication. So this is really important that you research before you join any plan. And if you need help, please give us a call. We can look up the plans for you, and we can tell you which plan cost you, throughout the year. You wanna see entire year, how much you're going to pay, not just that month. Okay. And so the enrollment in a Part D plan, like many times, our clients ask us, so do I need to join a Part D plan or drug plan? I'm not taking any medication. So the answer is, so you don't have to, but we strongly recommend people, our clients, to have drug coverage, because one thing is, if you don't have it's called creditable coverage, which means the benefit is equal to or better than Medicare's benefits. If you don't have that plan that covers your medication, that is called creditable coverage, then when you decide to join Part D later on, you will have penalty. And it's not as expensive as Part B, as in boy, late enrollment penalty. It's just like a 39 cents times whatever the month you didn't have the coverage. Uh, so, it's not that expensive, but it's lifetime again, as long as you have Part D coverage. So, like, say, if you're not taking any medication and if there is a $0 monthly premium plan available like this year, why not just join that plan? So that's our recommendation. You want to have a drug plan to avoid any late enrollment penalty and also coverage gap, because what happens if in the middle of the year you get prescription ordered by your doctor, you know. So we recommend people join a Part D when they have enrollment period. And Part D has other enrollment period. This is a little different from Medicare Part A and B. So once you join Part D or Part C, there is a open enrollment period every year. It's from October 15th to December 7th. And so that means, you are not married to that plan you selected the first time. You can just change your plan each year if it doesn't work for you anymore. And also, if you have Medicare Advantage plan on January 1st, you have Medicare Advantage open enrollment period, and it's from January 1st through March 31st every year. So sometimes people find out after changing their Medicare Advantage plan, their doctors are not in that plan's network. Then, it's not like you are stuck with that new plan. You can change back to what you had, or you can change to another plan that your doctor accepts, but it's only during this time. And Part D has a special enrollment period that's different from Medicare Part B. Again, example is there are like a different special enrollment periods available, but some of the examples here we listed are: you lost employer-based drug coverage, you moved out of the Part D plan service area, like say from California to you move to different state, or like if it's a Medicare Advantage plan, if you move to different county, you get this special enrollment period because some counties have different plans. And if you enter or leave a nursing home, you get special enrollment period, and you can switch to another plan, drug plan. And Part D can be very expensive, and there are some financial assistance programs. And this one is called Extra Help Program. And you can apply for Extra Help Program online and through Social Security's website. And these are the income and asset limits for this year. And if you are approved for Extra Help, you can join a $0 monthly premium plan and you pay $0 deductibles. So you get coverage from day one if you have Extra Help. And your copay amount will be no more than $5.10 on generic medication and no more than $12.65 on brand name medication. So it can be very helpful. But your income and asset needs to be below this level. And next one is Medi-Cal. So Medi-Cal is income and asset-based program, just like Extra Help. And it has a different income and asset limits. And it's income-wise, this is not like a hard limit, a hard figure. So if your income is a little over this income, you may still qualify for Medi-Cal because there are some deductions that they consider. So, but asset wise, this asset is asset limits came back from this year, and it doesn't include the home you live in and the car you drive, one car that you drive. It's basically money in checking, savings, and retirement accounts. And some people, they don't want to deal with Medi-Cal, and I understand that, but so that they, just want to apply for extra help. But personally, I think Medi-Cal gives you more benefits, so it's better to have Medi-Cal, because once you apply for Medi-Cal and you get approved, uh, Medi-Cal becomes the secondary insurance. So it pays your co-pays, co-insurance, and deductibles after Medicare pays, or before Medicare pays, if it's deductibles. And also it pays your Part B premiums, that $202.90. And Medi-Cal is your secondary. So uh, you can go to any doctor, Medicare doctor that accepts Medicare and Medi-Cal. And especially like say if you have Medicare Advantage plan, your doctor, they must see you. It doesn't matter if you have Medicare and Medi-Cal. There are some doctors who say, I don't take Medi-Cal. And if you have original Medicare with Medi-Cal, you may need to switch that doctor. But as long as they accept Medicare and Medi-Cal, you can go to see that doctor, and you shouldn't have any co-pays or co-insurance. So a person with Medicare and full Medi-Cal cannot be billed for their Part A and Part B co-payments or deductibles. So it's uh you know, it gives you more benefits than just having extra help. And another thing is, uh, if you have extra help, sorry, if you have Medicare and Medi-Cal, you get automatically enrolled into extra help, and your copay amount is actually lower than having extra help through Social Security. So if you have extra help with Medicare and Medi-Cal, you pay no more than $1.60 on generic and no more than $4.90 on brand name medication. So it's much, much cheaper than just having extra help. Okay, so here I have some this is about how Medicare and other insurance, employer insurance work together. I don't know if any of you have employer benefits still, but uh, it's different from like, say you are 65 or younger, and like, so here are some rules. So if you are 65 and older, and if you have employer insurance, um, and if your employer has 20 or more employees, your employer plan becomes primary. So what that means is you don't need to join Part B when you turn 65. You can delay it. But you want to make sure to talk to your HR, human resource people, to if you work for a small company, because sometimes they have a uh, different rules or settings. So it really depends on that company's policy. So you want to talk to the HR. And if you're younger than 65 and you have employer benefits, like yourself or through your spouse, and if your employer has 100 or more employees, then your employer benefit is primary, so that you can delay Part B enrollment. So that means you don't need to join Medicare when you're you've been on SSDI for 24 months, and when the 25th month comes, if you have employer benefits, and if your employer has 100 or more employees, then you can delay your Part B enrollment at that time. But if your employer has fewer than 100 employees, then Medicare becomes your primary insurance. So you really need to sign up for Part B to avoid late enrollment penalty. And also, uh, if you don't sign up Part B at the right time, you basically don't have primary insurance, and the doctor's office will bill you because you becomes the primary payer. Okay. And if you're working past, 65, and your employer has 20 or more employees, or like say if uh you still have you're younger than 65 and you still have employer coverage, and your employer has 100 or more employees, you have this special enrollment period to join Part B without being penalized. And it's 8 months. So uh, you don't need to worry about being penalized if you don't join Medicare Part B when you turn 65, or when your SSDI's waiting period or Medicare's waiting period ends. And if you have any questions about this, please give us a call. I'm so sorry. It's kind of complicated. Okay. And lastly, I just wanted to talk about this Medicare fraud. Medicare fraud is really, really going around in Los Angeles County more than ever. And the biggest problem we are seeing right now is a hospice fraud. And if you remember, hospice is covered Medicare Part A, and a hospice is basically for people who have terminal illness. And doctor certifies that you have 6 months or less to live. And once you are in hospice, you are uh, looking for comfort, not the cure, to treat your terminal illness. So if you are in hospice because somebody told you, oh, you can get this extra benefits if you sign this paperwork, or you can get this free gift, something, they may not say hospice, but if you sign the hospice paperwork and you are in hospice, you find out that you cannot see your regular doctors, your regular treatment will terminate because you cannot get, you're in hospice. So uh, if that happens, please call Medicare and file a complaint, or you can contact us, or you can call Senior Medicare Patrol. They are our partner organization, and they handle Medicare fraud, and they will assist you like how to read the Medicare summary notice. If you find anything suspicious, they will kind of look into it, and if it's necessary, they will refer you to appropriate agencies so that they can do investigation. And so it's really important, if you have Medicare, it doesn't matter if you have original Medicare or Medicare Advantage plan, you review your medical statement. It may call Medicare summary notice if you have original Medicare, or explanation of benefits, EOB, if you have Medicare Advantage plan. But you want to make sure to read these statements. So if you have any questions, you want to contact the provider's office and clarify. And if it's not clarified, you want to contact Medicare, or give us a call, or SMP a call, so that we can look into it. And you want to, make sure that you don't share your Medicare card or ID number with strangers. Medicare number used to be your social security number. So you want to treat Medicare number just like you do with your social security number. And marketing violation and enrollment fraud also happens throughout the year. What that means is sometimes you find out your plan changes without your permission. Like somebody changes your plan and you find out that you cannot see your doctor or your uh, treatment ends. If that happens, please contact Medicare, Senior Medicare Patrol, or us so that we can assist you. And also, like, when you talk to agent, sometimes they put their agenda on you. They may say, if you change your plan, nothing will change, but you can get just additional benefits. But once you change your plan, you find out everything changed. Give us a call, or you can give a call to Medicare and file a complaint. They cannot mislead you to join a plan when it's not true. Okay, so this is a summary of what we went through, and we have a little bit time left. I'm so sorry, but if you have any questions, please let me know. Yes, Tara.
Hi, I just have a question on the supplemental, I guess, because I
Uh-huh.
have Part A and I enrolled in Part B just recently, and it was a couple years after I got my Part A. So I'm having to pay that penalty you've talked about. However, I guess it's Medigap or whatever the supplemental is that you talked about. I'm just going to speak for myself. I have doctors that I do not want to change because they have been with me through my cancer journey. So if I get AARP, United as a supplemental, or Blue Shield as a supplemental, or anything like that, are they still going to do the underwriting? And because, obviously all of us here have had cancer or are going through cancer. So I'm assuming, one of the things that they are going to want to deny coverage for. That's one of
Right.
the main things. So is there I guess I have to make an appointment to come in and see somebody um, to talk about this more on a personal level because, again, the doctors that have been with me since 2019, since my diagnosis, I do not want to change.
Right. So, yeah, I mean, it really depends on your situation. Like, say you just got the A and B first time, and then within 6 months, you can get the Medigap. But, like, say if you had a employer coverage and it's ended, you have 6 months open enrollment to join Medigap without going through medical underwriting. And there are a few other life events that trigger the guaranteed issue rights or open enrollment period for Medigap. So yeah, you want to give us a call. Um, but yeah, if you just got you you already had parts A and B for a while, like more than 6 months, then then and also if you don't have any other specific like life events, most likely you may not be able to get Medigap, but uh it's depends on the plan too. So we recommend like people call everybody, like all the plan, companies and see if you can get coverage.
Okay, yeah, because I have a family member that's in the medical field, and she told me she's against the Medigap or the medical
Mm-hmm.
Medicare Advantage. To
Uh-huh.
She said to go with like a private company. Right now, unfortunately, I'm with Blue Shield, and I'm switching over to Medicare because Blue Shield they're so expensive. I can't even, you know, tell you how much.
Mm,
So I'm switching over to Medicare um, from private insurance. So
mm.
and I don't work. So I'll make the phone call and make an appointment to come and talk to somebody more in depth about this so I don't take up more time from everybody else. But I appreciate it.
Sure. Okay, yeah.
Thank
And I
you.
actually here is my our phone number again.
Thank you.
Thank you. Yes, Margot.
Uh, can you hear me? Okay. Uh,
Yes.
I just wanted to point another issue with Medicare Advantage. I had great Medicare. There was a great program through my husband's employment. It was employer sponsors, but it was a Medicare Advantage. I did my due diligence before I turned 65 and asked my oncologists and eye specialists. Yes, they took it. A few months later, I discovered they had all this stopped. It was a PPO. PPO said, you can go to anybody. And I never thought to ask whether my doctors would bill the PPO. It was Aetna. And so they had stopped taking the Medicare Advantage, the Aetna Medicare PPO. And fortunately, it was within the 6 months, so I could switch to Medicare and Medigap.
Mhm.
But it was just something that had never crossed our mind. One that insurance would refuse to bill our that the doctors would refuse to bill our insurance, or that they would just suddenly change. So I just wanted to
Right.
raise that as another danger of Medicare Advantage if you have specialists you really want to stick with.
Thank you. Any other questions?
Sorry, I
Yes.
had another question. I apologize. I couldn't raise my hand quick enough. Medicare Part D, as far as the drug part, I just barely got in under the mark for the Part B on March 31st. So I did get it. But the Part D, am I going to have to wait another year to add that if I want to add the Part D, or can I do that anytime?
So you just got B as in boy during the
Right.
GEP?
Yeah, I've had A since 2019, and I
Right.
just added the Part B
Yeah.
just this past March 31st.
Ah, okay.
So the Part D, as far as the drugs are concerned, the prescription drugs, do I have to wait another till the enrollment period again, or can I add that anytime?
So yeah, my understanding is that you have a special enrollment period to join Medicare Advantage plan right now, but not the D. And you need to wait for the open enrollment period, and your Part D is gonna start January. But give us a call. I want to be wrong about it. So, but I mean, we just talked about it internally, and we're talking about why we don't have special enrollment period for D when we have C only kind of things. But yeah, give us a call, and yeah, we will look it up, and we will make sure to give you the correct answer. But if you just join Part B in March, you should be able to get the Medigap.
Okay, because yeah, I don't know, again, I don't know if I want to do the Medigap. You're not saying
Hmm.
Medigap is Part D, or is it Part D?
No,
Because it's
no,
kind of,
Medigap is
sorry, I'm
different.
just confused. There's a lot of like letters and all that, and
Right, right, I know. Yeah. So
especially
Medigap,
with
yeah.
especially with us going through cancer. I mean, my brain cells, I can't retain that much. And it just is, to me, it's kind of complicated. But as far as a Part D, I do have to take a daily medication for
Hmm.
the cancer. So I just want to make sure that I can drop my primary, which is Blue Shield, which is
Hmm.
costing an incredible amount, go to the Part A and B, and then add Part D for the drug. So I'll call again and make an
Yeah.
appointment. I just didn't know whether you know off the top of your head. I appreciate it.
Thank you. Any other questions? Right. Well, if no one else has any other questions,